Well, thanks very much, Caroline, and what an exciting programme, and what great videos. I think Tom Hanks should be a little bit worried, actually. They're really good. I was also thrilled to see how in each of the videos the issue of public trust was highlighted as being of great importance, and I wanted to say a few more words about that, because the Public Advisory Board, or PAB, which I and several other people in the room are involved with, is particularly concerned that everything that HDR UK does will have this issue of public trust at the forefront of their minds, because we know that public trust is hard to gain. People, partly for a whole number of reasons, people really don't understand data, this kind of research. It's not something that if you stop somebody in the street, they'll necessarily have thought much about, and if they have, they may not have a very good understanding of it. It's highly technical. But we also know that people are concerned, are worried about use of their data if they don't know how it's going to be used or what for. So in our work with the hubs and with all the other things that HDR UK does, we've been invited to be involved in a very direct way. So two of our members, Margaret and Sarah, here in the front, read all the applications, all the hub applications, and I believe the sandbox ones as well, over the summer during the holiday period, and were involved in the selection. And that's just an example of the kinds of things we do in the PAB, as we call ourselves. But this issue of public trust is an even bigger issue for us. So as well as taking time and effort to earn, we know it can be lost very quickly. And anybody who makes a wrong step, a misstep, can quite easily end up in headlines in the press with lots of concerns about how people's data are being used. And I think in thinking about this, we believe there are three key lessons that we hope you'll all keep in mind. Firstly, transparency. Transparency is crucial. People are suspicious of things they don't understand or don't know, and there is no reason to keep secrets in this area. One idea I had, which I hope that you'll take on board if you're involved in a hub, is keeping audit trails of the requests for data that you receive and making those available so people know who wants to use data and for what purpose. I hope all the research that's been done will be published, and that's a fairly controversial issue, I know, but it seems to me that there are no good reasons for not publishing research, especially if it's done with public money. We have to be always mindful of the data governance rules, and security has to be at the forefront. And I know you're all very well aware of that. But that needs to involve external scrutiny as well as just those people involving data, and indeed public scrutiny. It must be open to public scrutiny. The second issue is clarity of expression. Because you're working in highly technical areas with a mass of jargon, it takes an even greater effort than normal to make this clear to the people whose data you're going to be using, all of us. And so I think, and I'm an ex-academic, so I think I can say this. Academics, this doesn't come naturally to all of us. So I do think that it must mean working with patients, members of the public, to craft good, clear communications, thinking about innovative ways to communicate. One of our members shared a really interesting example the other day, which was from an American study into, some of you will have seen the headlines, into the behavioral or the genetic basis for sexual behavior, which hit the headlines a few weeks ago. What they did was they worked with a patient group to think about how best to communicate this to the public. And they did a really nice video and a really clear clear website, which they crafted jointly with the LGBTQ groups that they had involved. It was a terrific example, and I'm sure that many of you know of other good examples, but getting that right, the clear communications, the media strategy, the working together with patient groups is going to be key, I think. And the third really key issue is involvement. As you saw, the hubs that were successful all have patient and public involvement. That's crucial. And it has to be ongoing. It's not a matter of just asking people at the beginning or at the end of a piece of work or telling them what you've done. It's much more than that. It means involving people in determining priorities. Involving in the research, involving individuals in thinking about what kind of outcomes are crucial to measure, involving them in the design of studies, thinking about how you're going to disseminate the results and how you're going to translate it into action. All of that needs to be done with the people whose data you're going to be using. But above all, I think the message from the PAB is think about public benefit. We know that the public will support this, as you saw from those examples, if they can see very clearly what you're doing, how you're doing it, and how the public will benefit. And if you can communicate that well, then I think you'll retain the trust of the public, and this research will deliver all those fantastic benefits that have just been talked about. Thank you.